Good morning, everyone. So, one of the things that I value heaps about the ancestral health sort of approach is, the recognition of the breed and all the factors that are interwoven into it. And yesterday we heard some fantastic presentations around behaviours and movement and the layers and the interconnections between those. But I guess on reflection, for me, they were sort of more about us reacting with a static environment in the context of the way that was discussed yesterday. And this morning, we're sort of moving into something that's a bit more dynamic. We're going to sort of listen to some people who have some views on dynamic environments and how and the role that we play and the impact that may have on our health and greater well-being. So on that quick note, I'd like to, with great pleasure, welcome Professor Simon Kingham. He's our keynote speaker this morning. Simon.
Thanks, Phil. I'm going to chat about the benefits and barriers to active transport as a way, I guess, of improving our health and well-being. I just want to give a bit of context because I think yesterday Brad kind of said that our experiences shape who we are and our views and attitudes, and I think it's worth just me telling you mine so you can see where I'm coming from. I'm a university professor, and that means I do two things. Well, I'm meant to do two things. I do teaching and research. So I research stuff, and I'm occasionally mention a couple of bits of research today that I think informs debate. And I teach, so when I teach, I'm meant to be able to learn about stuff I can then tell students about. So actually probably learn more through teaching, because you have to learn about everything you teach on. I guess I have a slight political role, because I'm on a thing called the Canterbury Regional Transport Committee, and it's the committee that informs transport in the region of Canterbury, where Christchurch is, and we have them all around the country, so you have to understand a bit about the politics and the frustrations of politics, but I won't talk much more about politics, because I'll leave our next speaker to talk about that. I'm also a New Zealand resident, and a citizen actually. I've been here for 15 years, but I was born in the UK, so I bring all that as well. So I grew up in the UK, where active transport is not, or has not been hugely promoted, but is being perhaps now. But I've also lived here. I'm a commuter and utility cyclist. I don't mountain bike, so for those of you who do, I apologise, I'm not one of those, but I do cycle to work, and I cycle to the shops, and I cycle to church and other things like that. So that's my cycling. I don't own lycra, equipment for everyone. And finally, I'm a husband and a father, so I fully understand why my children and my wife are less enthusiastic about cycling, and there are many times when I am less enthusiastic about cycling on certain places, because I fully understand why they don't want to do it, and why in some cases I don't particularly want them to do it. And I'll talk a bit more about that as we go along. So what I'm going to talk about, start by saying what actually is active transport, because it sort of seems obvious, but there's perhaps a little bit that we should bear in mind as well. A little bit on the benefits. I guess most of you will know, but there's actually quite a wide range of benefits of getting people to travel more actively, and it's not just in the most obvious ways. What are the barriers? So what are the individual barriers? And I guess I'm focusing more on cycling here, because for walking, the main barrier, I think, is distance. Most journeys are too long for people to walk, so I'm really going to focus on cycling. And then some of the sorts of more societal barriers. And then look at the end and say, what can we do to encourage active transport? Again, particularly cycling, but also walking as well. So what are the things that, as a society, what can government do, etc., to encourage people? So what is active transport? I guess the obvious ones are it's walking, it's cycling. Nowadays, for kids, it's scooting and skateboards. I've helped design transport surveys and employed organisations over the years, and we've had to add in scooting even for adults getting to work. Kind of interesting. But it's also public transport, and so quite a lot of the research actually says public transport counts as active transport, and I think that's important to include as well. And the reason is there's a whole bunch of research, I've just picked out a few of them, that show that when people travel by bus or train, they actually get a significant proportion of their daily recommended physical activity by just walking to the bus stop at either end or the train stop. So some of the research I'll talk about actually talks about active transport includes public transport. And so I think it's important to remember that because of the physical activity people get. And there are other benefits as well, which I'll talk about as we go along. That's the bus. I just want to put this in. Don't look at this is very complicated, there's far too much stuff on it, but I guess the important thing is to look at where active transport fits in terms of active living domains. And we've got household activities and occupational activities. Occupational activities, the reality is over the years, most of us actually do very little physical activity in work. So my job is largely desk-based, and the majority of people are. So the problem is, for a lot of people, that does not produce much activity at all. Household activity is similarly the same. A lot of people needn't do a lot of physical activity at home. I mean, a lot of it's outdoors, gardening, that sort of thing, but a lot of people don't do it. So we're really left with these two domains, active recreation and active transport. And I think interesting, Brad's comment yesterday, I think he said 50% of people when they go on, I think it was personal trainers, give up within 6 weeks. And I think the reality is that part you have to find time for. You've got to create time. And over our lives, sometimes that time gets squashed, so you get greater pressure to work, and that eats up that 5:30, 6:30 hours, which I think Brad referred to yesterday. Or people have a child, and suddenly they get home, they don't want to go to the gym for that hour, they want to be with their children, etc. So there's a whole bunch of reasons why I think this domain of activity is really important, because if you can get the physical activity in your regular day by travelling, you can actually get enough activity there that these ones, which are really difficult sometimes, are perhaps less important. So what are the benefits of active transport? Now, some of you will know all this stuff, but sometimes the figures are useful. This is a quote that could be from many countries in the world, but it is in New Zealand, that New Zealand is in a global obesity epidemic. This is from 2011, the future costs of which will be enormous, potentially unaffordable for the health system. That's got worse. Those of you in New Zealand will know in the last week we've had the government making significant announcements about how they're going to combat obesity, and I think we can critique whether we think they're actually going to work, but the reality is that it is a serious challenge for many countries, particularly developed and Western countries around the world. New Zealand doesn't come top in the league table for many things, but it does proudly come right near the top for obesity. We've got United States, Mexico, perhaps slightly ironically, Hungary is up there. But New Zealand actually does very well in the obesity league table. I think the latest one may even have us third, so we're certainly in the top 3 or 4. And when the New Zealand Medical Association looked at this and they said, what can we do about it, they listed a whole bunch of things, and one of them was making urban environments support physical activity. So the importance of the urban environment, and I think Julian Genta is going to talk about that later, about how we can actually design environments to make it easier for people to get physical activity. And a big part of that is about encouraging people to travel actively. Another question is, well, what's the magnitude? What is the relative importance of physical activity through active transport and through urban design in terms of obesity? I'll give you some numbers on that. I checked this week, and the latest figure I've seen for the global cost of obesity is now $2 trillion. Now, trillion is such a big number, I can't even work out how many billion it is. It's such an enormous number. And it's almost so enormous that I think people can kind of ignore it, but it's an enormous number. In New Zealand, some figures from 2006 said it's not far off $1 billion a year. So significant numbers. And if you think about how much money we invest in the health service to provide and help people with obesity, but then how much we could actually save if we took some of that money and invested it in ways of making people more active. And just to show you the relationship, this graph shows active transport. So these are rates of active transport, and then the little dots. So these are countries. So Switzerland, 60% of journeys, over 60% of journeys are by active transport. The Netherlands, around 50%, etc. And we go down to the US, where it's under 5%. New Zealand sits about with Australia, it's around 5%. The little black squares are obesity prevalence, and on a different scale, but you can see very clearly that in countries with very high active transport, and that includes public transport as well, they have much lower rates of obesity than the countries over here with very low rates of active transport and very high rates of obesity. And generally, if you pop other countries in, the graph seems to say the same. So there's a significant link between the number of people who travel actively and obesity rates. So what it says to me is that if we can improve, if you can move some of these countries this way, further up the graph, you would hope or expect to see reductions in rates of obesity. And there's a whole bunch of metrics we're starting to see. This is some research in the UK, and a quote from the newspaper in Ireland saying active commuters have lower BMI. So we can see BMI is reduced amongst active commuters. In China, they started seeing the problem as well. So while we see this as primarily a problem of Western developed countries, you've got countries like China starting to see this as a significant problem. Over 20% of all overweight or obese people in the world are now Chinese. And what they found in research in China is that urban design in terms of walkability is seen as part of the solution. So actually, if you make the environment more attractive for people to walk, you can actually alleviate some of that problem there. Research recently coming out just this month, Dutch cyclists have longer lives, say researchers. So some research has shown that in Holland or in the Netherlands, people who cycle live longer. And then a piece of research again late last year, looking at 18 waves of the British household panel. So it's a big survey, not just small numbers, but a big reputable survey. They compared to driving, well-being was high when using active travel or public transport. So people's well-being as measured with a psychological symptom was better. So general well-being seemed to be better amongst people who travel actively. So there's a whole bunch of different ways of looking at it. And well-being lower among workers with long commutes. So not only does the way you travel, but the length of the commute. And this, it was a survey carried out in the US, just a self-reported survey, and it found that people who had very long commutes, their level of well-being was lower than those who had short commutes, and it particularly applied for people who drove. So there's a whole bunch of stuff looking at this. Again, some research just published recently found that drivers have the most stressful commutes. So transit riders and people walking, they avoid unexpected delays, they avoid the stress of being stuck in traffic and not being able to get to their workplace when they expect. So again, there's a whole bunch of research all coming in from different disciplines and different areas, all coming up with the same finding. The way you travel has significant impacts on your health and well-being, as measured by numerous different metrics. And of course, what we've also found some research is that bicycling is the happiest form of transport. So not only do you physically better, but you're happier, which I always think is very nice. I don't always feel happy when I cycle. The car gets in front of me, but at the end of the day, I think overall, statistically, I am happier than someone who's driven. And I thought this one was interesting. The secret to telling you skin type like a bicycle. And this was a study that looked particularly at people about 70 or 75, and it showed that those who cycled went out cycling recreationally. The secret of happiness was the fact that they had lycra and went cycling. So that's nice as well. I just want to talk a little tiny bit about air pollution. One of the other benefits of getting more people using active transport is that ultimately we reduce the levels, we improve the level of air quality. So we get less people in cars, more people walking, cycling, or using public transport, then air quality will improve because there's less emissions. And we know that air pollution is estimated to cause 1.3 million deaths per year. And here's some numbers from different countries, and for those Australians and New Zealanders, we can proudly claim that our air is getting worse, and the number of people dying from air pollution is getting worse, as against too many countries in Europe and even the United States, where the number of people dying is actually declining. So we've got significant numbers of people dying from air pollution. We also can look at air pollution exposure. And what we do with exposure, I'm going to ask you a question. Now, I know some people know this, but I'm just interested to see how many. When you choose to travel by car or by bicycle, who do you think has the quality of the air is best around them? Do you think it's someone traveling by car, or do you think it's someone traveling by bicycle? So put your hand up if you think the person in the car, the air around them is cleaner than the person in the bicycle. So who thinks the cyclist's air is actually cleaner? You guys are way better informed than my first year students when I asked them that question, and I've asked them for a number of years. Because most research pretty consistently finds that the air around the car passenger is worse than the air around the cyclist and generally around public transport users as well. So these are some figures. We did a study we actually did the analysis in 2010. We published it just a couple of years ago. And these show Boston whisker plots for different pollutants. Carbon monoxide, there's the car passenger. This is the average value compared to bus, bike off-road and bike on-road. And the bike off-road was back passage, only fully separated cycleway where the cyclists went. And they all went from the same destination, origin, same destination. And the cyclist, interestingly, the cyclist on the road wants on the identical route to the bus and the car. And even when they're on an identical route, the cyclist is exposed to cleaner air. Particulate matter, a little more confusing, but the cyclists certainly not know more. And ultrafine particles, these are very, very fine particles that can penetrate very deeply into your lungs. Again, the cyclist lower than the car passenger, and the car and the bus not hugely dissimilar. What we then did is we got 3 cyclists cycle on one road, one on the road, one on the pavement, and one on a path in a park. And for those who know Christchurch, that was in Hagley Park. Also, this is the first bit, but this is the route they went from here to here. This is the cyclist on the road, and this is the cyclist who went through a park and then along the cycleway that's along a railway line. And the darker the colour, the higher level of pollution, so you can see it really visually. And what you can see, this is carbon monoxide, and this is ultrafine particles. And on this, you can actually see the point that the cycle path crosses the main roads. So it crosses at different points. Again, you can see where there's congestion and traffic lights. So it's actually a very sensitive indicator. And it shows very clearly the cyclist away from traffic is exposed to less pollution. As I said, we then compared 3 cyclists. These are percent of the road, so this is the road value of carbon monoxide. The cyclist on the footpath was literally on the footpath behind parked cars, so they were only 3 or 4 metres away. So this cyclist was on the road, this cyclist there, and then this one was actually off-road in the park in Hackney Park in Christchurch. And you can see you get quite a significant drop for all 3 pollutants. So it's carbon monoxide, PM1, which is fine particles, and ultrafine particles, which is very fine particles. You get a significant drop-off just by going 3 or 4 metres away from traffic. And you get the biggest drop-off by doing that rather than actually locating cyclists 10, 15 metres away. So when you choose to cycle, when you choose to travel actively, because we know the same applies to walking, the quality of the air around you is better than if you choose to travel by motor vehicle. So what we can conclude is that cyclists are exposed to less pollution than other road users, and actually a small amount of separation makes the most difference, significantly reduces pollution exposure. I'm not going to talk about climate change because Alison's going to do that, but getting more people travelling actively helps climate change. That's my 1-minute version of what Alice is going to tell us a bit more about later. We know as well that cities, as some research has shown, that cities with physically active residents are not only healthier, but they're more productive. So they're more productive as well as healthier. So there's another strand of research. And this leads into sort of more business benefits. So in the United States, in New York City, they've put a lot of physically cycle facilities in. And they've done some research to look at injuries, and they found injuries decrease, injuries on the actual road and on adjacent roads decrease. And they've also found that retail sales increase on that street. So where you put the cycleway in, the shops sell more stuff than they did before. Which is interesting because if you talk about taking parking away to put cycleways in, most businesses will say that's going to be bad for my business, I need cars parking outside my shop. The research actually says that's not the case. If it works in New York City, there's no reason why it can't work in any other country in the world. And New York City has dramatically changed. I went there recently for the first time in 20 years, and the centre of New York City is a very different place. They're really making great efforts to encourage cycling and walking. This is average, this is again some more data from the United States showing average customer expenditure by mode of transport and type of establishment. So you've got different types of establishment, you've got auto, bike, transit, etc. This is trips per month, dollars per month, and then the one we really want is total dollar spend per month. So how much are people spending according to how they travel? I'm just going to bring up 3 figures. Overall, the motor vehicle spends $60 a month, motor vehicle driver, the bike person $75, and the person walking $66. The transit user is slightly less, about the same as the car driver. But what it shows is that the cyclist and the pedestrian actually spend more money when they go shopping overall per month than someone driving a car. And again, that kind of is a perception that that the retailers don't think is going to happen. They think people have to be able to drive to the shop and they'll spend great amounts of money when they get there. The reality is not only do they get less people out of their shop, but actually when those people arrive, the mode does make a difference to how much money they're likely to spend. So it's good for business and active transport as well. This is a graph. Some of you will see an image like this. This is one from Canberra, just showing how much road space. Again, a kind of obvious one. If you get this many people in a bus, they take this much space. Bicycles, slightly more space, assuming the bus as well. But car drivers, if everyone's in a single car, which they mostly are, take a lot more road space. And I want to put a bit more on social capital. Research has shown, the OECD did some research saying that the communities that promote sustainable and active transport can reduce disparities between rich and poor, they're good for the neighbourhood, they reduce crime, and they allow people better access to healthcare. So there's a whole bunch, to healthy food rather, there's a whole bunch of different ways that communities that have lots of active transport are good for us and better for us. Some of you may have seen this. This is some work done in the late 1970s by a guy called Appleyard. And what Appleyard did is he looked at people's social interactions according to traffic volume. So this is a heavy traffic road, which was about 16,000 vehicles per day, a moderate traffic road, and a light traffic, and these were 8,000 and 2,000. And he asked people on those streets to plot how much interaction they had with their neighbours. That's the first thing he did. And on the heavy traffic road, there's some interaction, but generally on the same side of the road you live. People on this side don't really interact much with people on this side. Moderate traffic streets have increased significantly, so a lot more interaction. And where it's light traffic, less than 2,000 vehicles a day, significantly more again. So you can see that traffic volume has a significant impact on social interaction and community. Appleyard also did, he asked people to indicate where their home territory was. And again, on the busy street, it was very much their home. That was it. On the moderate street, a bit more expansion, and on the light traffic street, people said my home territory is a whole street, many of them. Somewhat sadly, Donald Appleyard died a few years later in road accident, which is slightly ironic, but very sad that a guy who actually demonstrated how traffic has this great impact on the community actually died that way. I had a student who decided to test this. She was only a fourth year student, so it was a very small project, but she just did this recently. She's literally finished the project last week, and I asked her if I could have her graph, and she gave me this. This is three roads in Christchurch. This one, Milton Street, is reasonably busy. It has about 14,000 vehicles per day. The adjacent one here, Roker Street, has about 1,400, and then she only had one person in this street which has 140 vehicles a day. It's a very small street. So just probably ignore the blue one and just look at the others. And what you can see, she asked them, where do you see your home territory? And amongst the people, the purple people on the busy street, much, much smaller. And on the people on the much quieter street, much bigger area. So in a very small scale study, we can see that Appleyard's results still hold true. That where you live on busy streets, people's social interaction in their community is much smaller than on quieter streets. So what do we need to do? Ultimately, it's pretty straightforward. We need more people actively travelling, we need more people walking, we need more people cycling, we need more people travelling by public transport. It's pretty simple. I guess the question is, how do we achieve that? And so this is where we start thinking, what are the barriers to it? So what are the individual barriers? And I am going to focus on cycling, primarily because I think with walking, distance is so overwhelmingly the big one. But there are other things as well about making it, and some of them apply. We did a piece of research, myself and an engineer called Glenn Curry did a piece of research in Christchurch, and we really asked the question, what type of infrastructure, or what are the barriers, and if it's infrastructure, what are the key infrastructure barriers to people cycling? We did this, fortunately, in the context of Christchurch just before the earth went. This is now, I think, the results of this are feeding into how we're rebuilding the system. What we found overwhelmingly is that perceived danger is the main barrier. It's actually not actual danger. If people don't feel safe, they're not going to cycle. You can tell them it's safe, because actually cycling is reasonably safe. And you can tell people that, but if they don't feel safe, it's going to make absolutely no difference. And very clearly, we asked a whole bunch of questions, and we showed them images, and we said rank them and rate them, and etc. And the key thing that you needed was physical separation. So absolutely, they said, if you're going to get more people cycling, you need to physically separate them from traffic. And there's different ways of doing that, but you have to physically separate them. So we know that with cycling, that's the barrier. There were a few other barriers. The helmet issue in New Zealand, Australia, the only two countries in the world with a helmet law where you have to have it. That was a slight barrier. Being able to cycling at night was a barrier. Weather was a barrier, again, not a major one. A place where you can store your bike when you get to work was another one. Clothing. People kind of had this perception that they needed a certain type of clothing, whether they look like that or they want to look like that. But there was kind of this perception that it was an important thing. The ability to carry stuff. So people said, I've got too much stuff to take to work, or I can't carry my kids. So these are all barriers in people's minds. But overwhelmingly, safety is the number one. You can solve all the other ones and you won't get many more people cycling unless they feel safe. So this is number one. Many of the other ones you can actually solve, but you've got to solve this one first. But then there are a bunch of societal barriers. So if we know that infrastructure is the key, why are we not doing it? Congestion. There is this perception that we have to solve congestion. So a lot of the time governments, you hear them saying, well, we must solve congestion. That is kind of our number one priority for transport policy. But one thing we know is that congestion actually isn't all that bad. It's not a great thing, but a small amount of congestion actually has some benefits. Because what a small amount of congestion does is it suppresses what we call latent travel demand. So all of you, if I say to you, have you ever not made a journey, or made a journey at a different time, or made a journey by a different mode, because you know the traffic's too bad? You'd probably go, I have. At some point I've done that. The reality is, for a population, that happens. So people in their mind say, the traffic's too bad, I'll do something else. And it works the other way around. So if you relieve congestion, if you make your target of making the roads really clear, more people then come out and use them because they say the roads are clear. And it works best in terms of encouraging people to use alternative modes when there are really good alternative modes. So you can't encourage people to, if you say to me, congestion is bad, it'll take you a long time to get to the central Queenstown today, that's okay if I've got a good alternative. If there's a good cycleway or a good bus service. It doesn't work very well if there's no alternative for me. We also know that congestion-free roads don't result in pollution as low as models tell us. So lots of people model congestion and they model pollution, And it makes an assumption that when the roads are clear, we all drive perfectly, and the reality is we don't, because we still brake. And so when we model it, it doesn't actually make a huge difference. So congested roads aren't that much worse than technically free moving traffic roads. Just to give you really, this is one of the neatest examples, I think, of why congestion isn't all bad. This is Chong. I'm now going to call it Seoul, because I'm not very good at pronouncing this. It's central Seoul. This is a long time ago. This is it was a river, but it got very polluted, sort of slum housing on it. And so in 1970, they thought a really good idea would be to cure congestion and build a big motorway on it. So underneath there is this sort of sewer/river. They put this big motorway, multiple lanes. And the engineer who built it in 2005, or in 2000, stood to be mayor. And he campaigned to say, I'm going to get rid of that, and I'm going to get the river back. And that's what he did. So he campaigned to be mayor on this campaign. He'd been the engineer who built this. And that's what it looks like today. And so there are still some roads, but you've now got this beautiful river exposed. Again, another view of it in 1970, 2005. The guy then became president of South Korea as well, so he's a powerful politician. And that's what it looks like. And if you look close up, it's amazing. And Seoul in the middle of summer gets to high 30s, 40 degrees. And this open and exposed river actually has an effect of cooling the central city a bit. And people go and walk by it to escape from the heat. So it has many multiple benefits in terms of slowing people down and being able to walk and meet people. And it's an amazing example of what can be done. And the question then asked was, where did the traffic go? Because what people expected is that all that traffic would appear on other roads around about. So that's logic, isn't it? It's like, well, if that traffic's got to go somewhere, all the roads around will be really congested. And so they asked an Australian guy called Jeff Kenworthy to do some research of where the traffic, and he said it just disappeared. There's no evidence. There's no evidence that there was extra traffic on the roads about, because what happens is a little more congestion and various other things suppress people's demand to drive. So congestion is not the worst thing in the world. We actually need a little congestion, and yet many countries, they still have this aim that we must cure congestion. What's the next barrier? I think it's the assumptions we make about what we're planning for in the future. And generally, I think most places, and certainly in this country, we're still planning on the assumption that car use is increasing. So we've got to provide more roads because there's more people driving. That actually isn't true, or it certainly doesn't seem to be true. These are figures, passenger kilometres by private car and light trucks. This is an index of 100 various countries, and it's going up and up and up. And then in various different times, around some point in the 2000s, vehicle use, passenger kilometres travelled actually starts to decline. In Germany, in the United States, in Japan, in the UK it's going, Australia it's going. So what we're seeing is actually people's desire, or people actually travelling, is declining in the last few years. And people have termed it peak car, and they're saying we're past the point of peak car use. Now the drop in petrol fuel prices in the last couple of years may possibly see this as a slight upturn. We're not quite sure yet. But generally, most people would say we have passed the point of peak car, and we should be planning for that. We shouldn't be planning for people choosing to increase and travel by car more. And what's interesting about it is, if you look at the figures, dare I say anyone over about my age and upwards, we're still driving more than our predecessors. So particularly older people, so I'm not picking on older people, but the older people are travelling more than their predecessors. If you look at young people, they are travelling way less. So the numbers here, the red one is 2009, they are travelling less than their predecessors. So this drive in change is not uniform, it's happening amongst young people. And there's nothing to say that this won't carry on through, in which case the numbers of people choosing to travel by car will continue to decline. And there's a bunch of reasons given for it. There's evidence of why. One is they want to be connected to technology, and you can't be connected to technology driving a car really. That increase in petrol or fuel price has hitting the people who are most vulnerable, to the poorest people, and the poorest people include young people. That they are responding more to climate change. And another one is that when you give good alternatives, and many countries around the world are now investing in really high quality public transport, and investing in cycle infrastructure, and when you give people good alternatives, young people particularly choosing to take them. So they're saying, actually I want to cycle, and if you give me a good alternative, I will choose to cycle. So this is happening, and it's happening amongst young people. So that assumption that we have to plan for increased car use is probably an incorrect assumption. Just to show you some figures, this is the New Zealand census, and And what you see is it's just plain. This shows all modes, but because you can't really see what's going on. If you look at the other modes, cycling, biking is this one, just increasing, and transit is increasing, public transport. So we can see that it's happening in New Zealand. If we look in Australia, it's certainly not going up, and bus and train use is increasing. And again, if you look in Australia, there's some really exciting examples, really interesting public transport, which is driving that change. So it's happening in the two countries nearest to us here. And Peter Newman and Jeff Kenworthy have written 3 books now. They talk about auto-dependence, and the first one said we're entering an age of auto-dependence, and the second one said maybe it's changing. And just last year, or even earlier this year, they launched their 3rd book, and they are saying they're hailing the end of automobile dependence. They're saying we're past the point where people are choosing to use their car all the time, and it looks like there's a shift, which is an encouraging one. There's also this perception, I think, that when governments talk about active transport, say particularly cycling, it's kind of seen as a minority thing. It's seen as a sort of slightly crazy handful of people, and we can't invest lots of money. What's interesting is there's a guy called Roger Geller, who's the Cycle Planet in Portland, and he's come up with this typology of cycle types, or some potential cyclists. People have looked at this in other countries, and it seems to apply elsewhere. The numbers may be slightly different. What he says is that about 1% of people are strong and fearless. I went for a walk the other day up the hill towards the gondola, and I think that most of them are up there, and they can't down. And those guys, if they get on a road bike, they don't care about infrastructure because they're going to cycle. And they're slightly crazy, I think. And then you get this group of up to about 6 or 7% who are enthused and confident, and you only need to give them a little bit of encouragement and they'll cycle. I'm one of them. I suspect Julianne's one of them. Many of you here might be them. And that's great. But we are a relatively small number of people, and if we don't do anything else, we're never going to get past about 7 or 8%. Christchurch is on about 7% of journeys by bike, and we're not going to get any more unless we do something. At the other end, there's this kind of 33% of people who will never cycle, and they're not going to. The Dutch don't get them, and the Danes don't get them, so we kind of have to know why about them. The problem is they complain and they grumble a lot, and they argue against cycling, but they are actually only a third. This is the group we're interested in. 50 to 60% of people are interested but concerned. They're actually really keen about cycling, and we need to accept that actually it's a big group of people. So don't treat potential cyclists as a really small group of people. They're actually a big group of people. And what you see in places where you encourage them, like the Netherlands and Copenhagen, they're actually getting 40 to 50% of journeys by bike. And they are still doing more to try and get more of them, because they know they haven't got all these people. And I think we're interesting is to see when they get to this, maybe some of these just start thinking actually it's not so bad, because actually it looks quite safe and it's quite fun. I want to mention a bit about taxation and subsidy. One of the arguments always is that if you invest in public transport or active transport, you are using road users' money. So car drivers pay tax, and we shouldn't then spend that on public transport and cycling, because that's inappropriate use of funds. This is the Ministry of Transport in New Zealand, so this is the government report. This is not done by the Green Party, no disrespect to Julianne, and it's not done by some academic like me or Alistair. This is done for the government. It's the Ministry of Transport report. Surface transport costs and charges. It says car drivers only pay 64% of the costs of driving on the roads. But the other 30% is coming out of general taxation. So everyone who doesn't have a car, when they pay their tax, they are subsidising car drivers. Truck drivers actually pay less, 56%. So when I cycle to work, I'm subsidising through my taxation. A truck driver. Bus passengers actually pay more, 68%. Rail users actually pay more, 87%. And this does not include exercise-related health. So it actually doesn't include a huge chunk of it. All that stuff about exercise, obesity and everything. So these are almost only underestimates. This report was produced in 2005, and if you go to the website where it talks about it, you can actually say they're reviewing it. And the latest one will be out in 2012. And then it will be out in 2013. And you keep checking, and the date keeps going back. The cynic in me says that they cannot find the right results, so they keep getting the analysis done. I think Julian made something actually pretty wrong, but it's interesting that this is 2005. They are reviewing it to see.
Actually, the report was undertaken because the Green Party negotiated with the Labour government at the time to get this report done.
Good. Yeah.
And now we can.
Yeah. So if people say car drivers should not be paying for cycling infrastructure and rail and public transport, you can just point out, well, actually, they don't even pay for the cost of the roads they're driving on, and the other impact or cost impact of them. So other thing, we know there's some really good research showing that when you invest in cycling, you get huge benefits back. This study was done by Alex McMillan, working with Alice, was showing that for every dollar, in essence every dollar you put into cycling infrastructure, you get $10 to $25 of benefit back over a number of years. Some stuff in the UK, every pound invested got £2.59, and this one, I sort of looked across the range of studies, and you got a benefit cost ratio of 5 to 1. It's a huge benefit, so every dollar you invest, or every pound you invest, or whatever, you get huge benefits in terms of health benefits, etc. coming back. This is Christchurch, that's something I'm just going to show you. Christchurch is currently investing in 13 cycleways, so it costs $160 million. And they've done a benefit cost ratio, and they've come out with a benefit cost ratio of 8. So for every dollar we spend, we get $8 back. Some people have criticised that, saying it's not quite 8. Even if it's not quite 8, even if it's only 4, let's just put that into context. These are the benefit cost ratios for the current programme of motorway building, roads of national significance. These are done by the government. This is their own benefit cost ratio. Again, it's not done by Julianne or me or someone else who may not think motorways are the best way of spending money. They are getting benefit cost ratios. In this case, it's under 1. So that means for every dollar we spend, we get less than $1 benefit back. So let's just put that into context. Cycleway programs are consistently getting figures upwards of 5. So when you invest in cycling, you get $5 of benefit. And these are getting, at most, one's getting about 3. So just to show relatively how much value we're getting out of things. So what should we do to encourage active transport? I think the key is we make it attractive. This picture's my mum. I challenge anyone else to get a picture of their mum in their presentation. The reason I'm showing that picture of my mum is I went back to England recently, and my mum is 84, and she doesn't cycle because she's 84, and she's had a major back operation 3 years ago, and she literally couldn't even stand up. I went to see my sister, and she lives near an old disused railway line which they've converted into a cycleway. And we hired bikes, and my mum cycled 25 kilometres that day. And she cycled it because it was a really nice environment, there was no traffic, and it was really attractive. And it just shows to me that when you make cycle infrastructure attractive and people feel safe, you can get 84-year-old women who don't cycle to cycle 25 kilometres. And it just accounts for basically making the product a better product. In London, they're doing things. This is, they're now doing a number of cycleways. They're doing this east-west super cycle highway that actually runs past Parliament along the river. So they're putting cycleways in difficult places to put cycleways, and not just doing easy ones. And this will be an amazing, physically separated cycleway that will run alongside the Thames. This is Vancouver. They're putting cycleways in, traffic counters. This is across the main road where they took, a bridge where they took a lane of cycleway out for physical separation as my son's cycling. This is was a two-way road. They made it one way, and cyclists can go both ways. And just to show you that they also, what they do as well is they put good street furniture in. So when you encourage people to slow the traffic down, you disincentivize cars, pedestrians come out, they put in street furniture, and people have places to sit. So you're actually creating what some people call biking places. People have places for people to meet. This is a thing called the High Line in New York. Some of you may have seen. It's an old disused railway line that used to connect, I think, the port to the place where they process meat, and it was an old railway line. It's about 30 feet in the air. And you can just see a bit of the old railway line that's not been used for years, so they're spending quite a lot of money doing it up to make it an amazing place of recreation. But it's also a place where people can walk from A to B. Because it's above New York City, you walk along it. It's really well landscaped, and you look into the building books on the third floor. And it's an amazing environment that's been created, and it's a really attractive environment. I went to Dublin recently as well, and they've got this amazing light railway line. And they're getting huge patronage with it. So if you make public transport attractive, people will use it. And what you find is that active transport becomes safer and more maintained. You attract those interested but concerned people, like 50 to 60% of people, and it makes it safer. So we know that in the Netherlands and Denmark, where the rates of active transport are the highest, it's also the safest. These are accidents or fatality or injury rates. And in countries like the US and the UK, where there's far less people, it's more dangerous. So the more people you cycle, the safer it becomes. And that shows, again, this is cycling rates in the Netherlands, and they declined from the 1950s to the 1970s. At this point, they started investing to get it back. And the reason is the accident rates went up as cycling rates came down, and as soon as they started investing, cycling rates came down. So you can see it not only between countries, but you can see it in a country where there was a dramatic change in cycling patterns. There's also gender equality, so what you find in countries where lots of people cycle, more women cycle. So as the interests of the concerned are disproportionately women, because they're more concerned about the safety. In countries where there are not many people cycling, it's mainly male, very few females. In countries where lots of people cycle. So over half of people who cycle in the Netherlands are women, compared to 20% in other countries. You see less helmet, well, you don't have helmets, obviously. People aren't dressed for battle. I think if you cycle in countries where there are low cycling rates, people are wearing high visibility stuff, or wearing lycra, they've got things sticking on their bikes, people won't tap them. And in the Netherlands and Copenhagen and places, people dress like they're just going out for the day. And you get more diverse people. So I like this one because there's two people drinking cups of coffee, there's a child. This picture's of one where I was cycling with my nephew who lives in Holland, and I saw this guy, and I thought, I've got to get a photograph of him. So I whizzed ahead to cycle, got off my camera, but he was actually going quite fast. So I got my camera and he was past me, so I did it again, and he was still too fast. And by the third time, I think he thought I knew him. So he waved. And I think you just don't get people like that cycling in countries where there are not many people cycling. So you actually get a greater range of people. And you get a greater range of types of bicycle. So people are quite happy having their kids. This is not, it's slightly unusual. It's not usually unusual, like lots of people cycle with kids and all sorts of things. Lots of cargo bikes. This is actually a guy and a girl going off to a World Cup football game in Denmark to watch it on television, and people are going drinking his beer while cycling. I'm not sure how to say that. They all look quite happy. This is the headline from the press, the Christchurch's newspaper, just a couple of weeks ago. And it's talking about speed, and I think to me, it summarises one of the messages I'm hoping getting over today, that we can not only slow down and save lives, but we can actually slow down and improve lives. That active transport is a slower way of travelling, but there are many benefits of travelling slower, so that we can slow down and save lives, but we can also slow down and improve lives. So final conclusions. Investing in active transport is hugely good economic sense, especially the health benefits. It's really, really good value. For every dollar you invest, you get heaps back. And the key is making it attractive. And I think Julianne might touch on some of this later, but for cycling, safety is the main barrier, and separation is the key. But the key is to make alternatives attractive, to make them fast to some extent, but they don't take usually longer, to make people feel safe, and people actually enjoy their experience. And we know all around the world there are examples of how you can do this successfully. Thank you very much.